Hello, this is Dr. Matt, and I'd like to take a few minutes to go over the informed consent about braces as well as instructions for you to follow at home. Braces are a wonderful treatment that can result in a wonderful smile, but also better positioned teeth to help them remain healthy and function for a lifetime if taken care of. With your braces, for our younger patients going through more comprehensive treatment, you will most likely be wearing metal braces. They may or may not have colors around them. We have been using more and more brackets called self-ligating, which means they don't need the color O-rings to hold the wire in. Some folks kind of miss the colors, but we're finding these new brackets to help reduce the number of visits that folks have to take off school or work to come in, so it's a pretty fair trade. And for our adults going through quicker, more cosmetic-based treatment, you'll probably be wearing clear or tooth-colored brackets. While these are more cosmetic than metal braces, they do have a tendency to chip or break a little bit more often than the metal ones, hence why we only really use them for quicker treatment times. Now first, I want to discuss possible side effects of going through braces, especially if consuming a high sugar or carbohydrate diet, along with not keeping our teeth and braces clean at home. The first possible complication is called decalcification. Decalcification, also known as damage to the enamel, or tooth decay or gum disease, can occur if patients do not brush and floss their teeth thoroughly during treatment. The same problems can occur without orthodontic treatment, but the risk is greater to an individual wearing braces or other appliances. Excellent oral hygiene is a must, and it will be insisted upon. Diet may need to be altered as well to avoid damage to teeth and braces. In your patient care bag, we will include a lot of extra tools to use at home to help keep things clean. Other tools like a water pick is also highly encouraged as well. The next complication could be periodontal disease or gum and bone disease. And that can develop or worsen during orthodontic treatment due to many factors, but most often due to the lack of adequate oral hygiene. If periodontal treatment develops and cannot be controlled, orthodontic treatment may have to be discontinued prior to completion. Next, I want to talk about patient cooperation. A patient's cooperation is an extremely important aspect of treatment success. Goals may not be reached or treatment time may be lengthened without a concerted effort by the patient. This includes being on time for your appointments, faithful elastic wear, also known as wearing your rubber bands, and any extra devices that we prescribe, and also great care for those orthodontic devices. The patient cooperation is an utmost necessity, and it will be insisted upon. Next, I want to talk about relapse, and that's the tendency for teeth to rebound towards their original positions, as this is a biological process. Now, very severe problems have the highest tendency to relapse, and the lower front teeth are also the most prone to relapse. Every effort will be made to avoid this, including overcorrection and the wearing of retainers. Full cooperation of wearing retainers is vital. Despite all the best efforts, relapse is still possible. It should be noted that teeth move throughout one's life, whether they've had orthodontic treatment or not. Now, the length of treatment depends on a number of issues, including the severity of the problem, the patient's growth, and also the level of patient cooperation. The actual treatment time is usually close to the estimated treatment time that we give you when we do our screenings, but treatment may be lengthened if, for example, there's unanticipated growth that occurs, or if there are some habits that are affecting the dentofacial structures, if periodontal or other problems occur, or if patient cooperation is not adequate. Therefore, changes in the original treatment plan may become necessary. Root resorption. Now, this is the tendency for the tooth roots to shorten during treatment and is a biological process that is neither well understood nor predictable. Under healthy circumstances, the shortened roots are usually at no disadvantage. However, in the event of gum disease later in life, root resorption can affect the long-term outlook for the affected teeth. It should be noted that orthodontics is only one potential cause for root resorption. Others include trauma, impaction, root canal treatment, and some of just unknown causes. Based on what is known, every effort will be made to avoid root resorption during orthodontic treatment. Now, a tooth could become non-vital, especially if the tooth has had a blow or trauma in the past, if it's been impacted or has had a large filling. If a tooth becomes non-vital, it would have occurred eventually and even without orthodontics. A non-vital tooth may require a root canal in order to be saved. Next, I want to talk about the temporomandibular joint, or TMJ, problems. These could include pain, clicking, or popping noises that may occur in or near the jaws at any time, including during orthodontic treatment. Possible causes vary wildly. A flare-up of TMJ problem during orthodontic treatment is almost always the result of a pre-existing disorder. We ask our patients to inform us of any changes in how the joint sounds, if there's any pain, and such changes may require separate therapy. Factors beyond our control can limit our ability to achieve the desired result with our treatment. These can include insufficient growth of the jaws, oddly shaped teeth, or oddly sized teeth. Such limitations may result in compromises or alternatives in the proposed treatment plan. As well, growth changes occurring after orthodontic treatment may affect the stability of the result. Retention at the end of your orthodontic treatment will receive a set of custom removable retainers. These retainers are designed to prevent your teeth from shifting after orthodontic treatment. Retainers will initially be worn every night and eventually every other night, and may taper off depending on the situation. We recommend retention for life to protect the investment into your smile. Now, as far as instructions go, gotta brush our teeth and gums thoroughly after each meal. And then as far as flossing, we want to floss at least once a day after brushing. And you want to brush your teeth in all directions. We recommend a fluoridated toothpaste. If you don't have toothpaste available, just brush with a wet brush. And then use fluoride or mineral mouth rinse each night after brushing prior to bedtime. Now, we're big fans of the Carry-Free system, the Carry-Free gels and mouth rinses. So talk to us about that if you're interested. Now, as far as eating habits go, nothing sticky, gummy, chewy, or hard. So examples could be gum, caramels, taffies, whole bagels. Want to lay off popcorns or nuts or ice cubes. If we eat fruit or vegetables, we want to cut them up. We want to cut off the corn off the cob. Don't bite into chicken or ribs or anything with a bone. Cut the meat from the bone and cut it into smaller pieces, those type of things. Also, if you develop any sore spots, we recommend rinsing your mouth with warm salt water. For tooth soreness, you can take a mild analgesic or whatever you would normally take for a headache or similar pain. We recommend Tylenol or ibuprofen, but studies suggest that ibuprofen could slow down tooth movement, so we've started recommending more Tylenol if you can take that. Next, we need to talk about wearing rubber bands. Most of our orthodontic cases includes wearing rubber bands as instructed for some of the time of treatment, if not the whole time. It's imperative that you wear your rubber bands as instructed, including all day, every day, if that's what we recommend. Failure to wear rubber bands can lead to teeth moving the opposite directions of the way we want, and or adding extra months of treatment time. So please do yourself a favor and wear those rubber bands. Now, feel free to call if you have any questions. Call us immediately if a wire breaks or a band or bracket comes loose. These aren't often emergencies, but we will schedule a special appointment to repair if your next adjustment appointment's too far off. Also, please remember that loose brackets happen. No need to freak out over this. It's just a fact of life. We will get you back in and get it taken care of if needed before your next scheduled appointment. We also want to minimize breaking brackets by making sure that we follow the instructions from before. That being said, it's okay if the occasional bracket comes off. It's nothing to get riled up over. Please also let us know 24 hours in advance if you need to cancel an appointment. We're getting booked out 7 to 8 weeks in advance, and being efficient with our schedule is imperative for us to keep up with demand. Also, if you're wearing a myo brace, a retainer, or functional appliances, always bring it with you to each appointment. Cooperation in wearing elastics or retainers or any other appliance is of the utmost importance to our ultimate treatment success. So I know this is a lot of information. Feel free to review this as many times as you need or go back if you have any questions. Thanks again for choosing us for your orthodontic needs. We really look forward to being part of your journey towards a healthy, beautiful smile.